Good evening, everyone. Thank you so much for joining us tonight. I am Dr. Rashida Monroe, Medical Director of Pediatrics at Wake Med Hospitals. Thank you everyone who's joining us through Facebook and YouTube on the Wake County channel. Welcome to our pregnancy edition of Ask the Doc. We're doing a town hall tonight where we hope to answer your questions about vaccine safety for those who are pregnant, trying to get pregnant, or breastfeeding. And we have some wonderful expert panelists who will join our discussion. I'll introduce them in a minute, but first I want to talk about where are we? Where are we right now with this? So we're doing great in our race to vaccinate Wake. As of today, 76% of people 12 and older in Wake County have gotten at least one dose of the vaccine, which is fantastic. But when we look at our vaccination rates for those who are pregnant, the numbers are nowhere near that high. We don't have numbers specific to Wake County, but we do have numbers for the US. And the CDC estimates that only 1 in 4 pregnant women have gotten at least one shot. And the numbers are even worse when we look at the breakdown for race and ethnicity. Only 11% of pregnant Black or African American women have been vaccinated. It's only 19% of pregnant women who are Hispanic or Latino. And that really concerns us because with this more contagious Delta variant, it's never been more important to get vaccinated. Vaccines help save lives. They keep people out of the hospital and they save lives. 2 weeks ago, the CDC released new studies and recommendations specifically for pregnant moms. And it gave really strong support that vaccines can protect pregnant moms and their babies. Nearly 110,000 pregnant moms have been infected by COVID-19 across the country. And the research shows that the risks to those moms and their babies is very serious. Pregnant moms who get COVID-19 are significantly more likely than people who are not pregnant to require intensive care, to be connected to a heart-lung bypass machine, and to be placed on a ventilator. The CDC also says that pregnant women with COVID-19 face at least a 70% increased risk of dying. Contracting COVID can also increase the risk of the mom developing a dangerous condition called preeclampsia. CDC research shows that it can raise the risk of premature and stillbirths. We're hearing some rumors that vaccines cause miscarriages. When the CDC issued the new pregnancy guidance this month, it shared a study of nearly 2,500 pregnant moms who were vaccinated during their first 20 weeks, and it showed no increased risk of miscarriage. Earlier research found similar reassuring data for moms who were vaccinated later in their pregnancies. So that's just laying the groundwork. That's where we are. But we're going to give you plenty of time to ask our expert panelists your questions and your concerns. And we are going to go ahead and get started. So first, I want to lay some ground rules. And the ground rules, Lachelle, we're going to have those, if you don't mind putting those up on the screen. We're going to show those ground rules, but also I'm going to remind you that there is a town hall poll that we want you to take. And that poll will be in the chat on Facebook and YouTube and will be shown on the screen, Lachelle, if you want to show that for us. And if you click on that town hall poll, we will ask you some questions and we will discuss the results before the town hall ends. For our ground rules, let's remember to be respectful of other participants in your actions and words. We're all learning, so don't hesitate to be curious and send your questions and comments. We want everyone to enjoy themselves and feel safe in this space, and we will take appropriate measures to ensure the collective well-being of our audience and participants. With that being said, let's get started. I would like to go ahead and introduce our panelists. So I will start with Dr. Carmen Beeman. Dr. Beeman is the chair of obstetrics and gynecology, and the Medical Director of Maternal-Fetal Medicine at Wake Med. Dr. Beeman, thank you so much tonight for joining us. Please tell us a little bit about yourself and what you want people to know about this.
Thank you, Dr. Monroe, for the introduction, and good evening and welcome to you all for joining this town hall. So as Dr. Monroe mentioned, I'm a maternal fetal medicine doctor, which in general terms just means I'm a high-risk doctor. It also means I've dedicated my entire career to helping women optimize their care to get the best possible outcome for their health, and most important, and also importantly, their babies. And I think this COVID pandemic obviously has impacted the entire world and their health and well-being, but especially that for pregnant women in unprecedented ways, and that's my interest. As Dr. Monroe mentioned, these risks to pregnant women are getting infected, being really sick, they're getting admitted to the hospitals, they're needing help breathing, and unfortunately, we're seeing them die at rates way higher than we normally see for any pregnant woman at all. Having a woman admitted to the ICU and dying is typically a really rare event in pregnancy, and one that prior to this I had really had to encounter. And it's been, I think hard on us all, and hard, to see that this is something that is preventable. And so this is where my interest lies. And I think that it's important for all to know that this is really hitting us all, especially even locally in our area. The numbers that are on the news are really being seen in our area. We're seeing double the number of women admitted with this surge into ICUs, and most scarily, they're dying. And we're not over with the surge. I know that all of us on this call and many providers have personally cared for women who have had COVID infections. These were previously healthy women, and I've seen them have to stay in the hospital longer, which means they're away from their families, they're away from their children. I've had others have to be delivered preterm because they've gotten very sick, they've gotten preeclampsia or high blood pressure of pregnancy. And I've seen others, even when they've recovered, their babies have problems, they're not growing well. And even in, rare but tragic things, we've seen babies die, we've seen moms die. And I just really view these all as tragic and, most importantly, preventable events, because we know COVID vaccines help prevent these things. They help prevent people getting sick. They help prevent people getting hospitalized. And most importantly, they prevent people from dying. So, as I said, I'm a person who's been always dedicated to helping pregnant women optimize and get the best possible outcome for their pregnancy in any way that I can. And right now that means helping all people, encouraging all people to get vaccinated, and most especially pregnant women. So beyond participating in town halls like this, and similar to others on the call, I too have participated in doing community events in Raleigh, Durham, and surrounding counties, trying to provide access and education to vaccines. And I really hope that the information we provide you tonight answers your questions about not only COVID vaccination and pregnancy and lactation and conceiving, and addresses your hesitancies and helps you take one step closer towards getting the COVID vaccine. Thanks for your time, and I hope I can answer any of your questions.
Thank you so much, Dr. Beeman. I can feel your passion and I appreciate you. I'm excited that you are here with us tonight. Next, let's go to Dr. Michelle Benoit Wilson. Dr. Michelle Benoit Wilson is a board-certified obstetrician and gynecologist, and along with many people on this call, has worked tirelessly over the past months in her community to help people get vaccinated, is a passionate advocate for vaccinating, especially our pregnant women. So, Dr. Michelle Benoit Wilson, tell us about yourself and why you are here tonight, what you want people to know.
Yeah, thank you for having me. Rashida, we work together and with Dr. Beeman and Dr. Gant and Dr. Etienne, who are in the chat room, and Lachelle, who's representing the county, and Nicole, for months to really get the word out about the safety of vaccination throughout our community. I remember last year when we were in the position of taking care of people and feeling very, very helpless about our ability to really do anything to prevent these devastating outcomes. And personally, my family experienced a tremendous loss when my cousin passed away from COVID in January. And even prior to that, his brother had been in the intensive care unit for 2 weeks on a ventilator last summer. And so I've personally experienced just the complete devastation to a family when you have such a sick family member and you don't know whether or not they're going to pull through. And then when we had the fortune to be vaccinated in December and then receive our second dose in January, there was really a sense of hope that we were going to get through this, that it was just a matter of time and if we could pull through. And from January to now, to see people still suffering from this, and we thought that we were going to be at a different point this summer, and to have experienced that type of loss but continue to see it in our community has really been extremely challenging as healthcare workers, but also as community members. And so I really want to relay the importance of getting vaccinated, address some of the questions and the concerns that women understandably have. We have women who are concerned about the effect of vaccination if they're trying to get pregnant. Of course, our pregnant patients are concerned about the effect more so to their unborn child than even to them. And of course, then we have women who are nursing and are concerned about whether or not they are doing anything risky for their newborn. And the answer to all of that that we'll be delving into is that the vaccine is completely safe. It's been well studied. It's the most well-studied vaccine in human history, in fact. And so we want to make sure that we're contributing to spreading accurate information, that we are giving women confidence in their decision to get vaccinated, and that we are really emphasizing the community responsibility that we all have to protect each other.
Thank you so much, Dr. Benoit Wilson. Next, I will introduce Dr. Nicole Meshanga. Dr. Meshanga is the Director of Epidemiology and Associate Medical Director at Wake County Health and Human Services. Dr. Meshanga, thank you so much. We are excited to have you here tonight. And why don't you just tell us a little bit about why you're here?
Thank you, Dr. Monroe. Good evening, everyone. As you've mentioned, my role has really been leading our county through this pandemic. I have been involved in our COVID operations since we've had our first case and have gone through the surges that we've seen in the winter and now with the Delta variant. Really, I'm here tonight to emphasize the need for everyone in our community that's not vaccinated to get vaccinated. We know that this Delta variant is 60% more transmissible. It is so much more transmissible, and it affects so many people. And we have seen just the surge and the impact that it's had on our community. So I hope tonight to share some more information about the vaccine and any things that we see kind of on the horizon, and encourage individuals in our community, especially our pregnant moms, to get vaccinated. Thank you.
Thank you so much. All right, in the chat, answering questions on YouTube and in Facebook are Doctors Angela Gant. Angela Gant is an obstetrician and gynecologist at Wake Med, and Dr. Stephanie Etienne, who is a family medicine physician with Wake County Health and Human Services. Let's go ahead and get started, y'all, because the questions are already coming in, and that is exciting. Our first question I'm going to send to Dr. Meshanga. Vielka asks, if you already had COVID-19, does that mean you do not need to get the vaccine?
No, so that is a question that we get frequently. If you've already had COVID-19, our recommendation is that you wait until your isolation period is over, and then at that point in time, you're able to receive the vaccine. And that's true as long as you haven't received any treatment specific for monoclonal antibody treatment. Then the recommendation is to wait 90 days to receive your vaccine after receiving that treatment. But I know there has been some concern of individuals that I've had the COVID vaccine, I've built up some antibodies, but what we've seen and what the studies have shown is that the vaccine generates a much stronger immune response and is able to protect you much better than what we're seeing with the natural immunity from the COVID infection.
Okay, great. That's helpful. There's maybe a follow-up question, because you mentioned, Dr. Meshanga, the therapeutics, monoclonal antibodies. So this question from David Weilers asks, where are the therapeutics? They don't come to the hospital because their doctors don't do anything for them and send them home to rest. They get worse and then they end up in the hospital. So Dr. Meshanga, what is the role of the therapeutics like monoclonal antibodies, and who should get them, and how do they go about doing that?
Yes, so this is something that I think we are working as public health to share the message that individuals that test positive and are within 10 days of testing positive or having their symptom onset really should inquire about receiving the monoclonal antibody treatment. The treatment does require an infusion, so it has to be done usually at a hospital that's able to manage that. So it's important, and I think what we're doing on our team is looking at ways that we can provide that information to individuals as they test positive. Normally, as you go through, when you test positive, your results and that information is sent to your local health department for follow-up. The health department will then reach out, and we are evaluating ways that we can share that information with those individuals so that, one, they know the locations, because there are specific locations that you would have to go to, and that they know when they should be inquiring about that.
Generally, is it true, Dr. Meshanga, that I know that monoclonal antibodies are approved for people who are 12 plus and a risk factor. And a risk factor can be something as I would say mild as a BMI, a body mass index above 25. And I say mild because my body mass index is above 25 and I feel like I'm pretty healthy. So the risk factors don't have to be something very severe. And the monoclonal antibodies, if given before you're very sick, can dramatically decrease your chances of having to go to the hospital and getting sicker and getting in the ICU. So, so for the most part, people can call their primary care doctor, who should be able to direct them. They need to do it before they get really sick. If you don't have a primary care doctor, your local emergency department or local hospital or local health department can give you the information about how to get monoclonal antibody.
Absolutely. That's the best resource is reaching out before you get really ill. That's important.
And it's free.
Yes, at no cost, So
that's huge. That's huge.
And I think it's also important, Dr. Monroe, to mention that monoclonal antibodies are indicated for pregnant women as well who are infected with COVID. And I know Dr. Beeman can speak more to that, but the pregnancy alone is an indication for receiving monoclonal antibodies, and stressing the importance of getting it before you get very ill within that 10-day period of time from the onset of symptoms is super important.
Excellent. Thank you, Dr. Benoit Wilson. That's helpful. I wasn't sure about the pregnancy, so that's fantastic. All right, the next question. Dr. Benoit Wilson, I'm going to direct this to you because you were integrally involved with a group of physicians who advocated for mask mandates in Wake County Public Schools. And Rachel Fitzhume Johnson writes, We need help in private schools. They aren't mandating masks and they're having huge outbreaks. Oh, I feel that frustration just reading it.
Absolutely.
Dr. Benoit Wilson, what would you suggest? First of all, should people be masked in schools? And how could we maybe advise or help people advocate for their children?
Yeah, absolutely. That's a super important question. And the reality is not only are we physicians, but many of us are parents as well. And so we're struggling not only trying to help take care of people through this pandemic, but also trying to take care of our families. The big difference between this year and last year is that last year our children were not in school for the vast majority, and they were able to stay distanced and they were able to stay home, and we've realized the importance for many of our children to be in school, to be able to have that option of in-person learning. But the problem that now is that we have a more contagious variant, and we know that the vaccine does not guarantee that someone who is fully vaccinated won't get infected. And the data has shown that a vaccinated person, if he or she becomes infected, can carry the same viral load as an unvaccinated person. And what we are reassured by with the vaccine is that the chance of severe illness and death plummet. It's not zero, nothing is, but it's extremely lower. However, there is the potential for any one of us to transmit a virus. And so the people who are going to be significantly affected are the unvaccinated, which include our children who are too young to get vaccinated. So we are definitely proponents of universal masking, following the CDC recommendations for doing that. And importantly, the quality of your mask matters, and how you wear your mask matters. You can't have gaps around your mask. If you're wearing a thin mask that does not filter well, it's not very helpful. And that's very much what we're seeing in the setting of an extremely contagious virus. And so hopefully we're going to be getting the message out that it's a layering of protection that we need. First and foremost is vaccination for those of us who can get vaccinated, but we also have to include the importance of masking.
Thank you so much for addressing that. I love the point you made. It's a layering, because you can think of that twofold: a layered mask for better protection, but also layering of different types of protection: distancing, masking, vaccinating, and washing hands. So thank you so much. And for Rachel Fitzhume Johnson, I would say don't stop advocating for your child. As a pediatrician, I personally have seen parents who are just so frustrated and anxious about the safety protocols at their school, whether it's, at the cafeteria or at lunch when kids aren't socially distanced and they're all unmasked, or that the school doesn't have a mask mandate at all. But we have seen that speaking up and not stopping and advocating can work. So find a group of like-minded parents who believe in science and support mask mandates, and keep advocating for your children. Okay, this next question. Let's send this to Dr. Beeman. I think it's Dearica K. Glenn writes, if you have already been vaccinated and get pregnant months down the line, how long is the vaccine protected for you and your baby? So how long is vaccine protection lasting, Dr. Beeman?
Well, Ms. Glenn, that is a fantastic question. And Dr. Monroe, I almost feel like Dr. Meshanga could say how long in general it's lasting, or all. I'll say that the information we have about the lasting effects are still being determined. What has been put out there about vaccination and pregnancy definitely shows that women who get it during the pregnancy, do passively transfer those protective antibodies across the placenta to the babies, whether you get it in the first, second, or third trimester. That we know. To my knowledge, I'm not sure that we know what that effect is in women who got it before and then get pregnant. And a lot of that, as we think about the timing of rollout for vaccinations and the length of a pregnancy, it's not determined yet because many of those pregnancies are still ongoing, meaning women who would have gotten the vaccine and now are pregnant, they're still ongoing. But as I said, I think it's reassuring to know that we do know that when moms have antibodies that protect us from COVID, it does pass along to the baby, not only across the placenta, but there also is in their breast milk as well.
Yeah, thank you so much for making that point about the breast milk. As a pediatrician, I talk to moms about that a lot, that they are passing immunity onto their children who obviously are much too young to get vaccinated. So that's an important point. Dr. Meshanga, can you speak to generally how long are vaccines lasting?
Yes, and yeah, so as Dr. Beeman mentioned, the studies are we're still watching and we're still evaluating data that is coming in. We know that it provides a longer term protection and immunity than what we see with the, if someone were to just have the natural infection or have the COVID infection. But what we're currently seeing and what we're currently hearing is that there might be some slight decrease in efficacy. And that's why we're hearing about booster doses in the fall. And they're seeing that right about 8 months. But what we know is that what is likely coming is that with booster doses in the fall, that individuals that are 8 months from receiving their second dose would be eligible to receive a third dose or that booster dose, just to help to get them right back up to that higher level of immunity. So it's the data is still out there and we are still evaluating. We know that it does provide great protection for a while, but we are still evaluating all of the data.
And Dr. Monroe, can I add that one of the questions that I get in the office frequently from pregnant women is, the idea that they think it's safer to get the vaccine later in pregnancy, or even more so to wait until after they've delivered. And one of the conversations we're always having is really stressing that important data that Dr. Beeman stated, which is that when a woman is pregnant, she actually does form antibodies to help protect her unborn baby after delivery. And those antibodies get transferred through the placenta during her pregnancy. There's also data to support that the earlier in pregnancy you get vaccinated, the better, that you actually produce more antibodies earlier in pregnancy and have more benefit earlier in pregnancy. So it's not true that there's benefit to waiting after the pregnancy. I understand why many women feel that or assume that. We also hear and understand the concern about getting vaccinated in the first trimester of pregnancy, which is oftentimes that area of whether or not there's risk of medications or anything else to a fetus that is developing, but that's been studied well as well, and there have not been found to be any increased risk of miscarriage, any adverse effects to a baby. My own sister-in-law was pregnant and got vaccinated during her pregnancy. Early on, we talked about it, and she's had a beautifully healthy baby boy. And it's so important to recognize the risk of actual COVID infection that far outweighs any theoretical, and they are theoretical, they're not proven risk of the COVID vaccine.
Thank you for adding that, Dr. Benoit Wilson. That's really helpful. That kind of goes into a question that you've addressed somewhat then by Shamia Wilson, who says, can we address the conspiracy theory that vaccines cause infertility? So you specifically mention no proven risk to or increased risk of miscarriages, though we know that COVID infection itself increases risk. What about infertility?
So the story, the same is true for women who are trying to get pregnant. We are encouraging all people, including women who are trying to get pregnant, actively trying to get pregnant, to get vaccinated. There's no reason to delay. There's no data to support the concern, which we understand, about any potential impact to fertility. Fertility is such an important, a cherished factor for many women. And so we understand where that concern is coming from, but it has been studied, and there is absolutely no relationship to any increased risk of miscarriage above what we would see in the normal population.
Thank you so much for answering that question for us. Okay, we've got a question from Samantha Price. And Dr. Beeman, I think I want to address this question to you. Samantha Price writes, I'm already vaccinated and in my second trimester. Congratulations for getting vaccinated. I know there's a high risk that I might get the Delta variant. What treatments are there if I do end up sick? How likely is it that vaccinated pregnant women end up in the hospital?
So Samantha, I echo Dr. Monroe in congratulating you on getting vaccinated. To answer your first question, currently the treatments that are available to non-pregnant women or people are the same as not, meaning that if you are not sick enough to require hospitalization, then as we've mentioned before, monoclonal antibodies are indicated solely with the indication that you're pregnant. So that would be the first. If you do end up getting illness that does require hospitalization, then again, some of the standard treatments that we would use outside of pregnancy are still used. Things such as steroid medications, we use frequently in pregnancy for other indications. And so therefore, again, would use in pregnancy. And then there's another medication called remdesivir that we also would recommend in and outside of pregnancy. Regarding your follow-up question of how likely you are to end up at the hospital if you've been vaccinated, I don't have the exact answer to that. I think we, in general, know, as we've discussed before, that being vaccinated decreases the chance for that. And I don't know, and I'll defer to the other experts on the panel if they know, but we do, I think, would apply this to all, meaning that it's still less than if you weren't vaccinated and still remains very unlikely to be hospitalized, as been shown in pregnancy and out. Most of the people being hospitalized are unvaccinated people.
Thank you so much, Dr. Beeman. And we know, when we look across hospital systems across the country, we're seeing this play out in our own hospital system, that 95% of the people who are, sick enough to be hospitalized in ICUs are unvaccinated people. And so I don't know that there's not an increased risk of catching Delta because you're pregnant. And maybe Dr. Meshanga, if you can weigh in here, but I would presume that amongst pregnant women, if we're comparing vaccinated to non-vaccinated, we're, the ones in the hospital, 95% of the time are going to be unvaccinated.
Yes, that's correct, Dr. Monroe. And there's a slide that I love to show that shows this difference, and it's significant. For individuals that are fully vaccinated, when we compare disease severity, hospitalization, and death, for disease severity, there's an 8-fold reduction in people that are fully vaccinated. When we look at hospitalization and death, 25-fold reduction for people that are fully vaccinated. So that's the importance, and that's the key that I think we're all agree that being fully vaccinated is going to give you the best protection.
So 25 times less likely to be hospitalized and get very ill and require ventilation if you are vaccinated versus not.
Absolutely.
That's impressive. I'll take 25 times any day of the week, playing the lottery or whatever, 20-fold, that 20 times, that's impressive. All right, thank you so much for that. That's very helpful.
And Dr. Monroe, I'm going to interject here because we were together at our county school board meeting when one of our colleagues, who's a pediatrician, made, I think, the very profound statement that she wants better for our children than just to not die. You know, and I think that really brings home that message. One of the things that I hear commonly is, well, you know, if anyone could potentially get COVID, even vaccinated people, what's the point? Well, the point is not dying is huge, but also not getting really sick is huge. Not having to be in the hospital is huge. Not having to be in a situation where the anxiety about whether or not your family is going to be severely affected is huge. So I think we need to expect more from our community than just saying that the only endpoint that we care about is death. I mean, it's important for us to care about general health as well. And that's what the vaccine gives us in addition to decreasing risk of death. It helps us have a milder infection if we were to get infected, and the numbers just don't lie.
Yeah, that's so important. And as a pediatrician, you know, we're seeing some of the long-term effects in children who have had COVID, even asymptomatic cases who may have multi-system inflammatory conditions that can get them in the require hospitalization and be very, very sick, you know, having inflammation throughout your whole body and all of your organs, and affecting your kidneys and your heart. Children who have even a mild case of COVID who want to return to sports, we evaluate to make sure that they don't have heart inflammation that's going to be dangerous for them to, you know, to return to play. And so I want a lot more for my children than to not just die either. I want them to be safe and protected. And for that reason, my oldest child who's eligible for the vaccine got vaccinated the very first day it was available. So absolutely believe in that. This is a question from Latanya Godbolt. And I'm going to take a stab at this first, and then Dr. Meshanga, I'm going to pass it to you. How could we explain why a booster shot is needed when so many see this as a sign that the vaccination is not working properly? And I'll just remind people that, like all of the other childhood immunizations you received and your children received, and like our annual flu vaccines, it is rare. There's actually not a single vaccine that we dose that one dose or even two doses is sufficient to give us the long-lasting immunity that protects us. You know, if you remember, your children come for their vaccinations at 2, 4, 6 months, 12 months, 18 months, again at 4 to 5 years old, and they are receiving some of the same vaccines as booster doses to give them the type of immunity that protects them for a long time. So this is not anything that's unexpected. We're still learning as far as how long that good protection will last with the COVID-19 vaccines, but it's not unexpected. Dr. Meshanga, did I misstate anything, or is there anything that you'd like to add?
No, I think that's a great reminder that this is not the first time that we're seeing this. And with these booster doses that we're expecting for the fall, they really put us back up there to get that really good efficacy, that good protection that we were seeing when you initially got that second dose. So I want people to understand the vaccines are effective, they are safe, and they're working. And that booster dose is just giving you that extra bit of, I say, a little bit of oomph to get you to that next level on that protection. So,
thank you. Our next question is from Vielka, and she asks, now that students are returning to school, do you know how soon children under 12 can get the vaccine? Dr. Meshanga, do you want to take a stab at that?
Yes. So what's important for that is that we're hearing that from the studies and from the data that's being currently collected, That's something that's probably going to be late, what we say late fall, early winter. So maybe towards December timeframe or early January is when we're anticipating that those under 12. There's a lot more that goes into when we move down to the younger age groups. I think we were able to transition a little bit quicker from the 12 to 17-year-old age range. And we were able to do that because we didn't have to make significant change. They didn't have to make significant changes in the dosing. And there were a lot of things that they were able to keep consistent. And so with going to that younger age group, there are some other factors that we have to consider.
Thank you. I know everyone's so anxiously awaiting approval in that younger age group. I let you know that my oldest son got vaccinated. My youngest son is in the Pfizer study for the 5 to 11-year-olds. And he may have, we don't know, it's a blinded study, but he may have received vaccine, but they are doing their very best to complete those studies because everyone realizes the importance and urgency. But of course, we're going to do this in a safe way when we have the data that supports that it's time. So thank you so much. Let's see. This is a good question about churches from Maria Gabriel. How do we help churches to understand the importance of wearing their masks as they are gathering at full capacity? Who wants to address that? Dr. Benoit Wilson, you worked with so many of these, the churches that we worked with and our faithful vaccination partners over the several months that we did our strike team vaccination efforts. What encouragement or advice would you give to our church partners who are back in full capacity?
Well, I would share that I go to church services where the expectation is that everyone is fully masked. I make that choice for our family because I don't want to take that chance that I'm increasing risk. And I think there are many churches that have taken that stance. Virtual services are being offered in many places still, and even if people are gathering, they're taking added precautions. And quite frankly, that is the expectation I have for my religious community, because if I'm going somewhere where I believe that my best interests are being kept at the forefront so that I can worship with community members, then I want those added precautions. We know that it's important to mask indoors, and certainly even when we're in close proximity outdoors to in an environment where we don't know what other people's behaviors may be, the safest thing is to mask.
Thank you, Dr. Benoit Wilson. The thing that comes to my mind is, love thy neighbor. And what better way to show love for thy neighbor than to protect those around you? So thank you so much. We are getting questions coming in fast and furious. I think we are going to have to, we're not quite in the rapid fire round, but we are going to see how many of these we can address. So we're going to try to keep our answers under 60 seconds to see if we can get through some of these, okay, before we end. So, Dearica K. Glenn writes, if someone has COVID and they're no longer showing symptoms, how long should they wait to test again for the most accurate result? So this is for Dr. Meshanga. Someone has COVID, they're no longer with symptoms. How long should they wait to test again?
So the recommendations that we provide are that if you've tested positive, there's no reason for you to test again. Really, we say that 90 days is that time frame that we say wait 90 days if you need to get tested again, unless you are feeling well and you've recovered and then you become symptomatic again. But really 90 days is what we say for people to wait if they're interested in doing another test.
So they don't need to test again because we want people to do their appropriate quarantine time, and even if the very next day after you were symptomatic, you had a positive COVID test, even a COVID test the very next day that's negative does not mean that you're free and clear of COVID. You're still spreading COVID. You still need to do your quarantine period and protect those around you. So there's really no need to test again for a negative. You just do the right quarantine. Is that true?
Yes, that's correct. Once you finish your isolation period and you have completed that, then there's no reason for you to test again. It's important you test, you know your status, and you're able to then isolate or quarantine if needed.
Okay, perfect. This question, Dr. Beeman, I wonder if you can answer this. It's from Josie Rathbone Cianez. I'm sorry if I mess up your name. Josie writes, I got the vaccine before becoming pregnant and was looking for somewhere to report it for study purposes. I haven't been able to find anything. I am signed up for VSafe.
I think, to my knowledge, Josie, you signing up for VSafe is the best way to do that. That is the way that the vast majority of our data is being collected to see, what happens to answer these important questions, infertility questions, miscarriage and pregnancy outcome ones. So VSafe is the way to go, Josie. And I think that's the way to go if you want to get be included in studies. There are other studies going on looking at it. Pregnancy outcomes that are from institutions, including WakeMed and others, but VSafe is the way to go.
Great, thank you. I'm going to answer this question from Shamia Wilson, who says, private schools are not mandating masks or social distancing. They also have cluster seating in the classroom. How can we try to ensure the safety of our children, even though the schools are not? So Shamia, I absolutely recommend, advocating for, to your schools, advocating for your children. But in the meantime, the ways that you can help keep them safe is making sure that they're wearing a well-fitted mask that with excellent filtration. There are many examples of this. There are masks that are like the KN94 masks that provide excellent filtration, are comfortable, come in kid sizes. You can look those up. And I think adding a layer of eye protection has not been talked up enough, in my opinion, but adding a layer of eye protection, which can be glasses like this that have this little wraparound. They're cute, and you can order them online, and they're not obnoxious, and children may be interested in wearing them if they don't want to wear the large safety goggles I bought for my children. So a well-fitted mask with excellent filtration and eye protection. And then, of course, washing hands and limiting the time that they're without their mask, even when it's in the cafeteria and they're near other students, kind of eating and remasking can even help minimize exposures. So this is an excellent question. And I'm going to read this question and you guys tell me who wants to answer this. This is from Marquez Odalise. Marquez writes, is there data on which vaccine pregnant women are mostly getting, Pfizer or Moderna? I'm in the middle of wanting to get vaccine and not wanting to because people are telling me it will affect the baby. I'm going into my 3rd trimester. So what are pregnant women getting most, Pfizer or Moderna? And how does she decide?
I can comment on the latter half of the question. I'm not certain, and I'm sure I could look it up while we do about that. But I will say, to put it in perspective, what is available in terms of when pregnant women are getting it, their highest numbers are in the 3rd trimester. So as we reiterated, a couple of times, with the data available, it doesn't matter the trimester that you get it. There are no concerns that will harm your baby. And so it would make sense to make sure that you are fully vaccinated as you're in your 3rd trimester and moving towards delivery to help protect yourself and your baby.
Yeah, and I'll answer with regard to which vaccine to choose. Really, any of the three are available to you, and they're widely available. There has been the reports about increased risk of clotting with the J&J vaccine, and so I've definitely had conversations with pregnant patients who are concerned about that. The risk is of a very particular type of clot in the brain. And even when that has been studied, that risk has not been found to be significantly increased to a level where we would recommend not getting that vaccine. And certainly, again, we know that the risk of COVID comes with it a significantly increased risk of clotting. And for pregnant women are at an increased risk of clotting because of the pregnancy. And so to add COVID on top of that is where the danger really lies. So if a pregnant woman really just wants a one and done type of shot, then I would definitely encourage her to get the J&J. I personally got the mRNA, the Pfizer, and that was the first one available to us. And different hospital systems may carry one over another and pharmacies may carry one over another for ease purposes and, kind of more logistical purposes. So any of them are safe.
Excellent. I say get the vaccine that's available. So just like you said, Dr. Benoit Wilson, get it. Dr. Meshanga, can you, from Alberta Jackson Freeman, can you repeat the information about 25 times or 25-fold? Can you repeat that statistic?
Yes, fully vaccinated people, their risk of death and hospitalization is 25 times less than those that are unvaccinated. And I'll be happy to, I'm not sure if we have a platform to share some of that information or share that slide, but it is pretty powerful to see that significant difference for fully vaccinated versus unvaccinated.
Thank you. Steve from YouTube writes, why did the COVID vaccines cause 80% of pregnant women in the first and second trimester to have spontaneous abortions? He's worried that we're lying and that will cause death. So Dr. Beeman, you are an obstetrician who specifically works with, high-risk pregnancies. Dr. Benoit Wilson, you work with, pregnant women every day, day in, day out. What have you seen? Not just what you've seen, but what are the studies showing about spontaneous abortions in the first and second trimester that Steve is concerned about?
Yeah, Steve, I'm not certain what your information or studies that you're reading, but in personal experience and also in what has been published by multiple journals, and that's why it's supported by all major organizations, CDC, ACOG, there's nothing to suggest that to have any validity to it. COVID vaccination does not cause, does not associate with the increased risk for miscarriage. COVID infection is.
Thank you. Thank you so much. Dr. Meshanga, does the booster, Cindy Peace would like to know, does the booster vaccine have to be the same manufacturer as your first?
Yes, so current recommendations are that if you receive the Pfizer, that you would receive the Pfizer booster. If you receive Moderna, that you would receive the Moderna booster.
Great. And along those lines, Lenarda Roberts Williamson says, a local pharmacy is offering booster shots for individuals who have chronic health disease, but I've not heard that booster shots are yet approved. Can you offer guidance?
Absolutely. So what currently is approved under the EUA, the emergency use authorization, is that for individuals that are moderately to severely immune compromised, and there's a pretty specific list of those individuals, they're eligible to receive an additional dose. So this is what we're calling a third dose for them. These individuals can receive that 28 days after receiving their second dose. And that's current what the current eligibility. When we mention booster doses are for individuals that are 8 months out from receiving their second dose, and that's likely coming in mid to late September.
Thank you so much. This is an interesting question. Dr. Meshanga, this goes back to you again. Latanya Godbolt writes, if a person passes away due to COVID, can you be around the body? Can contact from a deceased person still transmit virus?
But that's a great question, and I know that we have provided some guidance, and I have to say that from what we have shared and what we've shared with people in the past is that there's still an isolation period. However, we just recommend that there are precautions taken, but I would have to look more into the data to understand exactly what those precautions need to be able to answer her question fully.
Mm-hmm. It would make sense that for some period of time, contact probably with the bodily fluids, because we know that there's a lot of shedding of the virus that goes along even on the skin. But from a respiratory standpoint, being that they're no longer exhaling, it wouldn't make sense that necessarily from a respiratory standpoint. But I'm just thinking through that one and surmising. But that's an excellent question. Dr. Michelle Benoit Wilson, this question goes to you from Shanta Gauze. Shanta writes, would carbon dioxide be a concern while being masked? And I send that question to you, Dr. Benoit Wilson, as someone who spends a dozen hours a day masked, either in the OR, in the hospital. Tell me, is carbon dioxide a concern while being masked?
The answer is no. The answer is no.
The answer is no. From every healthcare professional has spent many, many hours masked before COVID and beyond. Carbon dioxide is not a concern while being masked. Thank you. Melinda Ortiz writes, are there any specific type of mask that you recommend for children? The first thing that I say is a mask that they'll wear. A mask that your child will wear, a mask that fits, and not a simple cloth face covering. You need more layers of protection. My children, who are 10 and 14, we purchased these, they're called KN94s masks, but they really do need to be fitted to the child. You can't use a large adult KN95 or KN94 on a younger child. And so those are the masks that we've been using. Does anybody else have anything more specific about what masks are recommended for children?
The importance is the fit. I think that's really key. It's important that it securely fits around their face to really prevent any type of viral sort of particles or things to actually get in and expose them.
A reminder, a wet mask is no longer an effective mask. And so after my child is sweating and running and playing and whatever they might be doing in their mask, once a mask becomes soiled or obviously moist, it needs to be exchanged. And I really appreciate all the masks that have the small net metal piece across the nose bridge where you can get a really nice, secure fit here and press so you don't have the nose slippage, because obviously a nose out of a mask is exposed to viral particles. So I appreciate that in a mask also.
And the mask with the little loops on the side that you can kind of pull. Dr. Monroe and our children wear the same mask because I ended up just kind of asking your opinion and seeing what they would keep on. And I find that really gives a nice snug fit on the side so that there's no leaking there.
The other thing that I'll mention for our kids whose little ears start to kind of burn and be uncomfortable after wearing a mask for a while is I just use a simple, you can use like a cloth hair tie or something like that. And I loop it into the loops on the ears and tie it here in a little bow. I mean, you can do that with a ribbon, but what it does is it takes the pressure off the back of the ears while still allowing for that nice snug fit. I do that for myself at work sometimes too. All right, a couple more questions. Jua Parawar writes, KN95 masks are one-way valve and could transfer virus. Could they transfer virus? So I am not talking about any mask with a valve, no valve masks, because you're right, those are not safe. They filter for you and expose other people. So no masks with valves. Jacqueline Kate Fissel writes, how long will my body produce antibodies in my breast milk after being vaccinated? That is a good question. Dr. Beeman or Benoit Wilson, I can take a stab at that, or if you guys would like to.
You know, I'll leave that to, I think Dr. Beeman's trying to answer that question.
I was going to say that I think it's a fantastic question, and I was trying to look it up as I read it. And offhand, I don't know offhand, and I don't know that anyone knows exactly. I know that people are still studying this going on, ongoing. But that obviously it's not a reason to not breastfeed, but I don't have the answer.
Well, and it makes sense that as long as you are producing antibodies, as long as you have protection, you will be continuing to transmit them, is what makes sense to me, as a pediatrician. And so if we're looking, like Dr. Meshanga said, that, 6 to 8 months out from our second dose, we still have protection, and then may need a booster shot to get the best level of protection again. You're transmitting antibodies from all sorts of things that you're exposed to in your breast milk continuously. They don't stop after the first 2 weeks or the first 2 months. You're always transmitting antibodies, from things that you're exposed to and fighting in your breast milk. So to me, it would make sense that that is a long term, as long as mom is still producing antibodies. Latanya Godbolt writes, I have been hearing some say that one family member tested positive, but others in the same household did not. They think that the ones that test negative don't have to quarantine. What would be advised in this situation? I'm always telling everyone I know that everyone in the household should quarantine. Is that correct? Dr. Meshanga, talk to us about that.
Yes. So whenever we have a situation like that, where one individual has tested positive, that person has to isolate for at least 10 days. But the other individuals in the household that have been exposed to them would have to quarantine for 14 days. And that 14 days doesn't start until their last until the person has completed their 10-day isolation, or some families are able to actually separate themselves. So from the date of that last exposure. So potentially it could be for the family member that did not test positive, it could be 24 days that they are in quarantine. So it could be a long time. There are some options to reduce quarantine, but it's just important that you're quarantining if you have been exposed, and especially with such close contact in a household or family member.
Yeah, that's a really tricky point that people have a hard time with sometimes. For the person who is positive, who is sick, they need to isolate themselves away from everyone else. But for as long as the people who are in that house have been exposed to the person who is positive or sick, from that very last date of exposure, they start their quarantine period at that very last day for 14 more days. So if you're in the same house the entire time, you're caring for them or not, but you're in the same house, and there's likely exposures in the same house. It's almost it's very difficult to be perfect with your isolation and quarantine. So it could be a 24-day period from the time that the first person is symptomatic and test positive. So thank you for walking us through that. Chua Parwar writes, sorry we missed the first part. When will vaccines be available for kids 5+? Which vaccines are getting close to approval for kids? I understand that Pfizer was first to start their 5 to 11-year-old studies. And so the first one that will likely gain approval would be Pfizer versus Moderna. But Dr. Meshanga, you mentioned earlier that it's looking like that may be late fall or early 2022. I know at one point earlier in the year, people were saying things like, maybe it's going to be September, but I think it's pretty clear to us at this point that it's not going to be that early. Is that what you understand?
That's correct. I think we were all very excited and thinking it would be in September, right around when school was starting. But we just want to make sure that the studies are being conducted and continue their rigorous process of evaluating the data. And so if it takes a little bit longer, we understand. But from what we're hearing now, it's probably later in the year.
Excellent. And I think we're down to our last question. You guys did an excellent job with what did become the speed round. The last question is, who should not get the Moderna or Pfizer vaccines? Is there any group of people that it's not indicated for? Dr. Meshanga, can I give that one to you?
Sure. So there are some recommendations for individuals that have had severe anaphylaxis or severe allergic reactions to the vaccines or are allergic to certain portions of it. But we have found that the vaccine is very safe and very effective. And our recommendation is having that conversation with your physician to really understand what your risk is so that you will know what's appropriate.
Thank you. That's helpful. When we were doing our strike team events and delivered 14,000 doses, knock on wood, we had not a single episode of anaphylaxis. And of all the people who came and said, I'm allergic to X, Y, and Z, we watched them more closely. They stayed for 30 minutes versus 15 minutes after vaccinations. We had the appropriate things on hand in case there was a bad allergic reaction, but 14,000 doses later, working with a lot of you and this wonderful panel, we had no bad allergic reactions. So there's hardly anyone who this vaccine isn't for, I guess is the answer. All right. Excellent. And that was our last question. So thank you all so much. We're going to wrap up in just a bit. First, I'd like to turn over to Lachelle Wardell to give us the results of our town hall poll.
Well, thank you, Dr. Monroe, and thank you to all of our panelists. You all were amazing. And thank you for answering all of these amazing questions that we had coming in. So I'm going to share my screen so we can look at the results of tonight's poll. 1 second here. Okay. So I will go back up to the top here so we can see we've so far had 10 participants to participate in tonight's poll. We ask which zip code you live or work within. We just like to get a sense from where our participants are coming from. And you can see that we were spread a little bit all over the county tonight. Let me see all of those so we can see where our responses came from. So all over the county. So thank you for that. We had 67% of our respondents being Black or African American, 11% white, 11% unknown, and 11% other. We also asked what your ethnicity was, and 78% of our respondents tonight were not Hispanic or Latino, while 22% were Hispanic or Latino. So we like to get a sense of who you represent. So 44% of you tonight represented the general public, 33% were public health practitioners, 22% were healthcare providers, and 22% were community organizers, and 22% were others. So a nice array of folks participating tonight. Of course, we asked age range, and with our respondents, 56% of our respondents were in the 46 to 65-year-old age range, 44% were in the 25 to 45% year age range. So great news. At least all of our respondents tonight are vaccinated. So thank you all for all of you who have already been vaccinated. And of course, if you weren't vaccinated, 86% said they've already been vaccinated, 14% said other. We wanted to get a sense of who you go to for your information. And so 89% of you said that you trust your healthcare worker, and that's where you go to get your information. 67% say you do come to the county and you trust the county government officials. 67% trust Dr. Fauci. 67% trusts and gets their information from CDC. 56% from our state government officials, 56% from President Biden, 33% trust and get their information from community health workers. And I know we had quite a few on tonight, so great job, you guys. Y'all are making a difference. 33% get their information and trust Governor Cooper, 22% from our radio or TV news reporters, 22% others, and 11% for faith leaders. So thank you all for all you are doing, and thank you for participating in our poll. I will at this point turn it back over to you, Dr. Rashida.
Thanks so much, Lachelle. We appreciate you and your work and everybody behind the scenes at Wake County. And thank you to Dr. Angela Gant and Stephanie Etienne, who answered questions online on YouTube and Facebook. We've got a couple of minutes left, and what I'd like to do is for the three panelists, I want you to give me just your parting remarks. Why should people get vaccinated? Should pregnant women be concerned about bad effects of the vaccine? What's the last piece of advice or information you want people to remember after this wonderful conversation? And Dr. Benoit Wilson, I am going to start with you.
Yeah, I think as a physician and a mom, I know the position that so many of our patients are in. They are doing everything that they possibly can to have the healthiest and safest pregnancy. And the facts are really indisputable that getting vaccinated is part of that picture. We have had in the past 18 months, 131 pregnant women die from COVID. That out of over 100,000 women who've been infected, that is a startling number. That is higher than what we see from other non-COVID related reasons when we look at the number of women who die per 100,000 women. And so there's just no way to escape the fact that this is dangerous. And so your families deserve to have you, your children deserve to have you, and you deserve to be healthy and to get accurate and safe information.
Excellent. Thank you so much. Dr. Carmen Beeman, what are your parting remarks? What do you want people to remember?
Everything that Dr. Benoit Wilson said, and just to drive home, what I know is that pregnant women are often, they all are good moms, even before their babies get here. And sometimes taking a medication is the right answer to make you stay safe and to keep your baby safe. And this is a perfect example of where taking the vaccine is the best thing and is by far, whatever concerns that you may have, it is definitely not as risky as you actually getting the infection.
Thank you so much. Dr. Meshanga, I'm going to say something really quickly. There's one last question that came in that I'll just answer really quickly, and then I'm going to let you do the parting remarks. The last question that came in from Jacqueline Kate Thistle is, antibodies should still exist and be effective if breast milk is frozen, then thawed appropriately, correct? And not specific to COVID, but in general, the immune properties of your breast milk do decrease slightly with the processing of pumping, storing frozen. But when thawed appropriately, you still have significant protection in your breast milk. And so fresh milk is best whenever you can get it, refrigerated milk, but as long as you're not scalding and overheating and appropriately thawing milk, you still are delivering antibodies to your child. And Dr. Nicole Meshanga, and now for your last remarks, what do you want people to remember and to consider after tonight's town hall? What do you want people to know?
Well, we want you to know that being fully vaccinated gives you that protection, the protection to be healthy, to live, and to be present, with your family. So if you have the opportunity, there are various options throughout our county where you can receive your vaccination. Please do get your vaccine so that you can be the best you and be present and be there for your family.
Excellent. Thank you all so much. As a reminder to everyone listening, you've all been vaccinated, it seems, but remind your friends and family that the vaccines are free. You can get them at your primary care doctor, local drugstore, Wake County Human Services. A lot of places will allow you to do it without an appointment. So don't let there be any barriers in your way. Transportation can be provided if you need it, but don't let anything stop you from protecting yourself, your family. The best time is right now. Don't wait. We appreciate everyone and your expertise in this engaging conversation. I think tonight was fantastic. I learned something from all of you. So thank you so much and good evening, everyone. We'll see